September is marked as Rashtriya Poshan Ma or Nutrition Month as part of the government's national flagship program, Poshan Abhiyan, also known as the National Nutrition Mission. This program was launched by the Honorable Prime Minister Narendra Modi back in 2018 with the agenda to reduce undernutrition levels among children below 6 years of age, pregnant women, and lactating mothers in the country. This year, Poshan Ma is being marked with the theme Supokshit Bharat, Sakshar Bharat, Sashakt Bharat, which is well-nourished, well-read and empowered India that primarily focuses on the key human life cycle stages, which is pregnancy, infancy, childhood, and adolescence. To know more about the month and its importance, we are joined by Dr. Hemlata R, Director, Indian Council of Medical Research, ICMR, National Institute of Nutrition. She's also a renowned researcher and an expert in the field of maternal and child health and nutrition. It's always a pleasure to have you on our show, Dr. Hemlata. Thank you for joining us. To begin with, Dr. Hemlata, I would like to ask you, how important is marking an entire month as Poshan Ma, and how can it help our country achieve its nutrition goals?
During each Poshan Ma, hundreds of millions of sensitization activities take place, focusing on key themes related to nutrition. So it fosters nutrition understanding. Across the country, several hundreds of millions of people also participate in these activities. This year, the 6th Rashtriya Poshan Ma is centered, as you have rightly pointed out, on Suposhit Bharat, Sakshar Bharat, Sashakt Bharat. That is nutrition-rich India, educated India, empowered India. The aim is to promote nutrition understanding, to tackle malnutrition through a life cycle approach during vulnerable life stages like pregnant women, lactating mothers, adolescent girls, and children under 6 years of age in a very integrated manner. Under this main theme, we also have sub-themes like Swasth Balak Spardha, wherein people will be participating in competitions to learn about exclusive breastfeeding and also the importance and significance of complementary feeding right from 6 months of age. And also there is another sub-theme called Poshan Bhi Padhai Bhi. Then another third important one is improving nutrition through Mission Life. Mission Life is a public movement. It mobilizes people to become pro-planet, where, when people start demanding healthy food, naturally the supply dynamics will also change. And the vision of this Mission Life is to trigger shifts in policies that can support both sustainable production and sustainable consumption. There are also other sub-themes like tribal-focused nutrition sensitization, because among tribal population, yes, nutrition is much more compromised than rest of the population. But here again, sourcing nutrition through locally available foods will greatly help. And this movement will also increase their knowledge. And also there is another sub-theme around anemia through test, treat, and talk. So I'm sure this Poshan Ma, the 6th one that we are celebrating, is certainly going to improve knowledge across people and across segments, different sections of the population, and also different stakeholders.
Dr. Hemlata, like you rightly pointed out, spreading awareness, improving knowledge, and so that people know what to eat and how it benefits them across various age groups and stakeholders. How would you assess India's performance as far when we talk about meeting the targets for maternal health, infant, as well as child nutrition?
This is a very interesting question. Yes, stunting declined from 48% in 2006, all of us know very well, to 35.5% in NFHS 5. And India's share in the global burden has also declined from roughly around 30% to 25%. Apparently, all these decreases appear a little small. However, if you look at some states of low-index states, there has been a striking 5 to 7% point decrease in stunting. And the prevalence of overweight has been increasing in most of the states, even among the rural population, even among the low-index states. And also there are secular trends occurring. There is improvement in height. And in certain states like Kerala and Tamil Nadu, the secular trends are almost like developed countries. It is happening at the rate of what you have seen in the last few decades in developed countries. Another important point that we have to remember is when wasting has not improved. In fact, it has become worse. But if you actually look at the data, 50% of the so-called children who are wasted are actually normal for their age. So how do we categorize them? Yeah. When we look at the nutrition status for age, 50% of the children who are categorized as wasted are actually normal. That means they are growing tall, So relatively, if you measure their weight for height, they may be falling short, but actually, since they are growing normally, they cannot be classified as wasting, because wasting is something pathological. A child who's really wasting will not be growing linearly, will not be growing tall. Tall children whose weight for age is normal, 50% of them are being categorized as, 50% of wasted children are actually under that category. So the metric of nutrition status that we measure currently actually fails to capture those children who require immediate attention. These undernourished children, if you follow them for a period of time, most of them follow their normal growth trajectory. But there are some few children who falter in the trajectory, who do not gain weight, who falter, do not grow linearly. So those are the children actually who require immediate attention, but the current matrix is unfortunately not capturing them. And because of this focus on all these children, our attention on those children who actually require focus is being diluted. So I'm afraid we have to come up with some strategy where we focus more on those children who actually falter in weight and height.
Dr. Hemlata, given that the 2030 deadline for the SDG goals, the Sustainable Development Goals, how far is India from the target, and what has prevented India from, as of now, becoming malnutrition free?
Yeah, there are 17 Sustainable Development Goals adopted by the UN member states in 2015 with 169 targets with wide range of social, economic, and environmental challenges. By 2030, we have to reach. Nutrition is at the heart of most of these goals. So any improvement in these goals will translate into improved nutrition, and improvement in nutrition status also will translate into better sustainable development goals. Yes, India has performed very well with respect to maternal mortality, neonatal mortality, under 5 mortality rates, then immunization, full coverage of immunization, then improvement in sanitation, and also child marriage, adolescent marriage, and bank accounts for women. All these are connected with nutrition, and we have done fairly well with respect to these. However, with respect to some certain targets, like 2/3 of our districts are off targets with respect to nutrition-related indicators like poverty, hunger, and also health. Health is also a big issue, and we are far behind reaching the SDG goals. Education, health, etc. Then how do we improve these? Yes, we have to shift the focus of the agriculture sector from the current system of staple food production to a diversified cropping pattern. This is under active consideration, not that we have to start from scratch. Then policies influencing production, marketing, and trade to improve accessibility, affordability of healthy food, which is also being deliberated. In addition, community involvement, their improvement in knowledge, attitude, and practices are also very important.
Dr. Hemlata, taking from the point what you said, of course, besides the other factors, when you spoke about women, right? Obviously, considering they are decision makers, and many times women don't they don't prioritize themselves. And also, according to the National Family Health Survey, anemia is on the rise in India, and as per NFHS 5, now double the percentage of women are affected by anemia than men. What are the challenges India is facing, considering when we have Anemia Mukt Bharat, which is a government scheme? How do we overcome these roadblocks? Because anemia has been a challenge for our country since the very beginning.
Yes, anemia you see across different segments, low socioeconomic status, as well as people who are coming from well-off background. Across India, you see these are because of reasons like, if you go to the poor socioeconomic status, people are thriving mostly on cereal-based diet, which is low in micronutrient, that to polished ones, highly polished rice and polished wheat, which are deprived of micronutrients. Again, if you move to better upper socioeconomic strata people, there are easily accessible HFSS diets which are high in fat, sugar, and salt. They access easily, they are accessible and also affordable. They buy those things instead of eating healthy diets. So dietary habits, food habits are quite poor across segments, even among the educated and even among the illiterate people. It is not just limited to one section of the population. No wonder we see anemia across population, different age groups, and different socioeconomic status. Yes, the government has rolled out this fortified rice program, which is very, very timely. I mean, if you cannot improving your healthy dietary habit is the most sustainable one to improve your hemoglobin status. But in the short term and the mid-term approach, fortification of foods is the right approach. So the government has rolled out fortified rice with iron, with folic acid, and with B12 also.
Okay, no, I think poor dietary habits is exactly, what you said. And again, we need to improvise on that. But at least, we're talking about this, especially with the government program. Dr. Hemlata, this year Poshan Ma focuses on promoting breastfeeding practices. How much progress as a nation, as country, have we made when it comes to propagating breastfeeding? And also, how can we still, there are so many beliefs and myths. How do we bust these beliefs and myths which are prevalent across our country?
Yeah, breastfeeding, exclusive early initiation of breastfeeding and exclusive breastfeeding. Early initiation is within half an hour of birth is required. I mean, it has improved a lot, but not at the rate it should have been. The hospital admission, institutional deliveries has gone up to 90, near 100% in most of the states, even in rural areas. Institutional deliveries has improved. When institutional deliveries has improved, why not improvement in early initiation of breastfeeding? And exclusive breastfeeding? Exclusive breastfeeding is still at somewhere 60%. And early initiation is also around somewhat that level. But if you actually see the data for different age groups, it is still at 30 or 35, 40%. So we have a long way to improve early initiation of breastfeeding and exclusive breastfeeding. This is the most sustainable way of feeding. I mean, it can prevent tons of greenhouse gas emission that can occur through formula milk, by cutting down on packaging of formula milk, transportation, and production of formula milk. Each 1 kg formula milk production generates roughly around 4 kgs of carbon dioxide. Huge production of greenhouse gas emission. So for clean environment, breastfeeding is very important, not only for the health of the women and the baby, which is all well known, but we now know that greenhouse gas emission can also be prevented.
I think what you said, we all definitely, this spread is happening, awareness is happening. People know that how good it's for the mother and child. But the important takeaway here is that how, if you're breastfeeding your child, it's good for the environment as well. So, if for your future generation, I think that's another important takeaway today. But Dr. Hemlata, India faces this dual challenge of undernutrition as well as overnutrition. We see that obesity is increasing, especially we also see it's highlighted in the NFHS 5 report. What is the government's strategy to tackle these twin challenges of undernutrition as well as overnutrition and obesity?
Yeah, this is very, very critical for us to understand. Our focus is mostly on undernutrition, but our focus on overweight, obesity, and not only just overweight, obesity, otherwise also the diet-related non-communicable diseases is increasing amid epidemic proportions. NFHS 5 also showed 1 in every 5 persons suffer from hypertension, and diabetes is also increasing not just among city population or urban population, but also increasing more rapidly among the rural population. Once upon a time, this fatty liver disease used to happen only among alcoholic population, but now the term itself is the non-alcoholic fatty liver disease, which we see now in India. 30%, 40% of the people suffer, even among young people, even among children, it's happening. This is all because of, again, poor dietary habits and excess consumption of sugar can also lead to this. 80% of the diseases that are that non-communicable diseases, particularly diet-related ones, can be prevented. It is in our own hands. Eat healthy and do appropriate physical activity.
Thank you, Dr. Hemlata, for explaining that so well. So many times things are available, but we don't have the right knowledge about it. And like you said, availability, of course, is key. It's always a pleasure to have you on our show. And thank you so much for sharing all your expertise with us.
Thank you. Thank you.